Hello, I'm Dr. Margaret Coates, Superintendent of Owasso Public Schools, and welcome to another episode of Safety Talk Tuesday. Our podcast today is Healthy Kids Equals Happy Learning. And with me today, I have our lead nurse in the district, Miss Haley Schlepp, and also Director of Safety and Security, Mr. Paul Croft. So thank you guys for being here today on this podcast.
Absolutely.
So we're just so we're just going to talk about health services in the district. And so let's just start off with Haley, you as lead nurse. Tell us a little bit about yourself, your background, and then what led you down this path, and how did you end up being a school nurse?
Yeah, thanks for having me today. So I actually, we moved from Colorado 2 years ago, like 2.5 years ago. And I love being in the school district, but I have been a nurse for 14 years and have spent most of my career in the emergency room. And then I had a year in the recovery room.
So emergency room, you're used to like things just happening nonstop.
Yeah.
So that's perfect because you're at the high school now,
yeah.
right?
Yeah, exactly.
So things are happening nonstop, right?
Yes,
now.
yes. But I love it. I love being with the high school age group. It's perfect for me. But what brought me to school nursing was when we moved, I just knew that I wanted to do something to make my daughters proud. And I remember saying that in my interview, and I don't know if Paul remembers that, but...
do you remember that?
I remember Haley's interview well, yes.
So I just wanted to be with kids and in the school district, and I love that.
So how your kids do they attend school here in the district?
Yeah,
That's
I've got
awesome.
one at Hudson and one at 6th grade.
Okay, that's awesome. So they love it that mom's a school nurse.
They
And
do.
you have a great schedule, so you're able to participate in all of their activities and everything. That's awesome.
Yeah.
So tell us what the structure is, Paul, for the school nursing. How is it organized? Because we've got school nurses and we also have health aides.
Health aides, yeah.
And then we have backups, I guess,
We started
the
a
backup
sub-program.
to the backup. Yes.
We started a sub-program this year. But, for us, we service 15 sites. We have 9 elementaries. And our elementaries are set up with 2 sites. So a nurse has 2 sites, but she also has a health aide with her. So they will split time between those buildings. So if the nurse is at Hudson one day, the health aide may be at Morrow, and then they'll switch at some point during the week. And so that way we have full coverage in our elementaries. We are very fortunate and blessed that this year we were able to add another nurse, which took us to the 10th nurse in the district, and they are all bachelor RN nurses.
I was going to ask that. Now,
Yes.
are they what type of nursing degrees do they have, and what level?
And for us, in the state of Oklahoma, they require them to be certified teacher, basically. And so a bachelor's degree RN is what qualifies them. But we were fortunate this year to go with a nurse in every secondary site this year. So 6th grade, 7th grade, 8th grade. And then East and West has a nurse as well. So,
why did you think it was important to have a registered nurse at every secondary site, but then kind of split up the elementaries?
Well, as they're getting older, so 6th grade center, right? We merge in 9 elementaries to one site, and so the acuity, which is some words that I've learned in this
Good job, Paul.
in
Good
this
job.
role is. As the older they get, sometimes the more these issues may arise with these students. And so having a nurse go back and forth between 6th and 8th grade, let's say, with 1,500 kids just wasn't working. And so to go to 700 kids, 750 kids in a building, we just felt that it was time to put a nurse in every building. And thankfully, you and the district decided this is what we need to do for our kids. And it has really worked out well for us. The care that they get is unmatched.
Yeah.
And so we have 2 buildings where we have full-time nurses for our special needs students and our and that's the 7th grade and Northeast. And so we have full-time nurses there that that doesn't have a health aide.
So Haley, talk to us about, because you're talking about acuity and you're talking about needs for special populations of students. So what are the range of those needs? Like, what's the most minor to like the most, I guess, acuity, or the most, I can't think of the word to say.
It's
The
like
high,
the severe
the
things.
severe,
that we
like the
do.
most severe, because I really don't want to say severe, but the range of care required for the types of students that we have in order to keep them healthy. So they're coming to school and they're still receiving health services while they're at school, and they're doing that so that they can come to school and be in class and keep learning. So tell us what that range is and what that looks like.
Well, we can, we see a whole bunch of different things come through the office, and it can range from a simple scrape on the knee that needs a little fixing up to be able to get back to class to we have students in the district that are diabetic that need additional care. We have seizures, kids that have seizures that we put, there's action plans that doctors put in place that we follow, a wide range of different students that we care for in the district. I know some in the severe and profound classrooms might have tubes or G-tubes or different things that have nursing care that we collaborate with all of those teachers.
We have playground falls and broken arms.
Yep,
and
that too.
sort of thing. And you not only take care of students, there's sometimes when our own teachers and faculty and staff, they need some care too.
Yeah.
So you're available for that. Well, what led you into the field of nursing? So you got your degree, but what made you want to be a nurse?
Well, I actually knew from a really young age, and because I got an ear infection. I used to have ear infections all the time.
Okay.
And I remember I had a mean nurse pull my ear really hard.
And you're like, no,
when she was checking my temperature, she
Yeah.
pulled it really hard. And ever since then, I knew I wanted to be a nurse, and I didn't want to be a mean one. So
well, that's awesome. That's neat. So you might be inspiring others right now, these students, to become nurses. So
yeah,
that's
I
really
certainly
neat.
hope so.
Yeah.
Yeah.
Yeah. Let's see. I've asked about. Well, tell me this question. I wrote some questions down here. So I know you're here at the high school, and it probably looks different than at the elementary school, but can you describe in general what a typical day for you is like from start to finish?
Yeah, it varies. Every day is a little bit different. We have students that will come in through the office for all kinds of reasons, whether they are coughing or they have body aches or a fever. And so as the nurse in the building, we kind of assess through that to see if it's a situation where the student really shouldn't be at school because they're really not feeling good, or if it's something that I can help support them and help get them through the day. Oftentimes we'll have students come through that are a diabetic that need a little extra care, or a snack. I mean, really, the range of students that comes through is so great. We have some students that come in that are hungry. That after more conversation, we'll find out more that maybe there's not enough food at home.
So then you can provide those resources for them.
Which is what I love. I love being able to help wherever I can, or help seek out other people that can help.
So you're filling in a gap that is not just about healthcare. It's a whole, it's social, emotional, the whole thing. Yeah.
So,
That's
and
neat.
sometimes students will come in that might feel nervous about a test, and it might be presenting in their body differently, whether it's they're feeling a little dizzy or lightheaded because they're nervous about a test. And so we talk a lot about that in my office, that stress can do all kinds of funny things to your body.
Yeah. So what do you do with the frequent flyers that you're like, how do you handle that? That someone keeps visiting over and over, and you think, okay, there could be something underlying. Do you reach out to parents or teachers to try to figure figure that out?
Yeah, it's definitely a collaborative effort, and it does take a little bit of time to find a pattern. Usually, first thing is to call home, and what ends up happening there is oftentimes parents are grateful because they're like, I didn't know that she had a headache for 4 days straight. And then other times it's been where they've been able to take the student to the doctor after a call home. So I do love that part too, that we get to collaborate and work together with the parents.
Partner with the parents.
Yeah.
So you start your day and immediately you have students coming in to see you every hour, and then you're just seeing those students. And do you have some regulars where they are required to come see you at certain times?
Yeah, we do. Kind of, they're scheduled throughout the day, so we do have students that we help support with the daily medication that they may need throughout the day that would be prescribed by a doctor. And so we follow those orders. And so oftentimes that's can be land around maybe lunchtime. I know for some of the nurses in the district, it's kind of scattered throughout the whole day when they have a daily medication. And then elementary, I do know that they get real busy at recess. Recess is their busy time.
You could be
for
an
sure.
ambulance caller too after recess on occasions.
Kids running around and playing on the jungle gym and falling off.
And getting outside is so good for them.
Yeah, it is. It is.
Yes.
Well, and then how does your day typically end? How do you close up shop?
Close up shop
quickly.
Quickly. No, usually I would say for me after lunchtime, everyone seems to be a little settled, and the ones that were feeling bad maybe in the morning have felt better. I usually loop back around and check in on those students, and then close up the office and head out.
How many kids do you see a day, do you think? What's your average?
At the high school, between both campuses, West and East Campus, we're averaging about 85 to 90 students a day.
Wow.
Yeah.
Wow. What about, Paul, do you have any stats on the rest of the district on like elementary visits? I mean, you don't have to go by site, by every site, but maybe total per day or on average.
So just for an example, last year in August of 23, between all of our sites, we've seen roughly 3,100 students in our offices in the month of August of 2023. Wow. Now, that could be from an ice pack to a Band-Aid to a scrape knee.
Recorded visits.
It's a recorded visit with students coming to the office, and that's just 1 month. And so we've been averaging anywhere from, September of 23, we had about 6,800 visits. And so you can kind of tell when flu season and things like that pick up because our office visits go sky high during the day. And so then you can tell when we have healthy flu season and whatnot's over with, because those go back down to, and I say go back down, but we're at 3,000 or 4,000 visits for the month. Yeah. But we have reached as high as almost 7,000 in certain months of the year
so you guys
in the district.
Yeah, so everyone is definitely hooked up for sure. Busy.
And the one thing that, I took this, the nurse program over about 3 years ago from a lady.
It's like, Paul, have I got a deal for you? You're going to be perfect at this. Yeah. And you are. You do a great job.
It's been, and it's really been fun. But the thing that I've noticed about the nurses in the 3 years I've been doing this is they accept the challenges daily. And I think from their background, where they come from and what they've done in the hospital, they look forward to the challenge and how they're going to fix it and how they're going to make it work. No 2 days are the same. And we were fortunate in the district about 2 years ago. I decided we're going to put radios in all the nurses' station. And if they need help, they get on the radio. And our nurses, they don't even bat an eye. They go. And they'll leave their building to go help. And we do that several times during the week. And so that's one of the things I appreciate about the nurses is they are go-getters and problem solvers. And they don't set back, whether it's dealing with policy or what. And I appreciate it that we have updated so many policies since this group of ladies have taken over. And so they're a big-time benefit for the district.
That's awesome. Now, are there any new things coming on the horizon for the Health Services Department in January?
Yeah, we're really excited. We have something new that's going to come out for the parents. It's called the Health Portal. And the best way that I can describe it is it would be something very similar to like my chart that the hospitals provide or doctor's offices. And it's just going to be a way for parents to be able to access different records from their students here at school regarding their health needs.
So they'll be able to take those records to their own doctors if they need to.
Yeah, if it's something,
or they can their doctors can send it to us directly.
Like immunizations for one. If a parent lost the immunization records, let's say from the doctor's office, and they moved out of state.
Those are so hard to keep up with.
They
I
sure
have to
are.
admit, they are hard to keep up with.
They are. They're always changing.
Yes.
But so a parent would be able to go into the new health portal and be able to find that information. So
and that's the neat thing. What was it? 3 years ago, we bought this program. It's called SNAP, and it's a program that was invented by school nurses. And I think when we first got it, I think all of them were like looking for me the
like,
first
why
6
do
months.
What? We have to use this?
Yeah, because it was such a big monster.
Yes. Well, any new software application, it just takes time to learn. There's that learning curve.
And for us, the documentation, the charting, the records, all that stuff that this program offers our district has been unreal. And, that's one of the things that we appreciate because we get that through bond money that helps pay for those programs. It helps give us the portal and helps us do those kind of things. And so it just keeps growing, and we're fortunate to get to add another piece to
Well, when you
our
have
parents.
7,000 visits, or if they're, know, what you had mentioned earlier, and you've got to keep track of those, we've got to have a way to do it. So, I'm glad that we have that.
Yeah. And, and there's several other programs that our nurses are involved in with education with our students in elementary classes that they, whether it's dental hygiene or whatever, all those kind of programs that the nurses do is amazing for our kids. And then when you come to the high school level, and I've gotten this question a lot, is, well, you guys just pick who you want for drug testing. Well, we're over the drug testing program. And so I just want to kind of put it out there how it operates.
Yeah, let's talk about it.
And
So
what
how
our
does it work?
nurses' involvement is in this program. And so for us, we drug test 7 through 12 if you're involved in extracurricular or curricular activities. And if you're going to be out of class and missing class time, we are going to drug test our students. And that is not us picking the kids.
It's a privilege to participate in those things, and so we want to make sure that they're healthy and also representing the school well when they're
And so
activities.
Our nurses, we pull from what we call Rank 1, and our fine arts and our athletics are part of that. And so Haley will pull the list and make a master list, and then we send it to a company in Tulsa. And then at that point, we are done.
So they just kind of they just randomly send names from that list.
They randomly send us the names back, and we get those names a day ahead, and then we get lists, and we observe the kids in the 4-year area while this company comes in and does the drug testing. So we never pick the kids, and we never drug test the kids. It's an outside company.
You're just organizing it and having them come in.
Yeah, we're just the organizing of the group. And so it doesn't matter who you are or what sport you play or what activity you're in, you are subject to a drug test here.
And it's just our intent to ensure that our kids stay healthy. And so what happens if someone tests positive? What would happen then if a student tests positive?
I'll let Haley talk to it a little bit, but our policy is pretty clear on it. But we have a 3-step process in there. And so I'll let Haley gets to set in on some of those meetings.
Yeah.
Because I know that could be kind of, hard for parents to hear and hard for students. So, so how does that usually happen?
If a student does test positive from a random drug screen, I will let their administrator know, and then they will set up a parent meeting, and then it'll be a meeting with the parents and with the administrator, and then whoever the activity is. So if it's a coach, or
sponsor.
A director, a sponsor. And then per the policy, it just kind of depends on what, like if it's their first offense or their first time getting testing positive or their second time. It kind of depends on how, like the consequences, I guess, would be.
So the drug testing, though, just to be clear, if they do test positive, it's there's consequences related to that activity that they're in. They don't necessarily get suspended from school
and that's the deal. We don't want them gone from school. We want them to be here because part of that first step process is it's a 15-day out of the activity practice, miss a couple of events. And you also have to complete a 3-hour drug course that we offer here
to get
at
some
the
education.
school. Get some education about some things.
Yeah.
And believe it or not, if a kid tests positive, they are subject to be tested at any time moving forward. And it's clearly stated in our policy. So we are very fortunate here. Very few test positive.
Yeah.
And so
with all the number of kids that we have participating in all these activities, that's really good to know that we've got this in place. And really, it's in place not only it's as a deterrent. If you're going to have the privilege of participating in the activities, this is a deterrent. But it also is if there is a positive, it's also a support. It's to help early intervention, find this out now, so we can make sure that parents know and we can work together to get students the help that they need.
Yeah, absolutely.
Yeah. So my last question for you, Haley, is what is your absolute favorite part of being a school nurse?
Well, I can say that after 3 years, or this is my 3rd year here, that just to see these kids grow has been really, really wonderful. Coming from seeing the kids as freshmen and now they're almost ready to graduate, they've just grown and changed so much. And I love that. I love to hear the follow-up and their hopes and their dreams of what they want to do. And I love being a part of helping them grow up and achieve that.
That's awesome. So those relationships that you've built and you get to see them move through this school, but then also move on down the road.
Working in the ER, I never had that.
Yeah,
so
it's just they come in once and then they're
exactly.
They're
so I love to
I
be
hope
able
they're okay.
to have relationships. It's great.
That's really awesome.
Yeah.
All right. Well, thank you, guys, for being here today. Really appreciate your input, and gosh, we appreciate the nurses so much.
Thank you.
Really, we could not function and keep our kids healthy and partnering with our parents without you guys.
Thank you.
I think behind the scenes, I don't know that people really know, how hard you guys are working and all the things that you're doing. 80 to 100 students per day are rolling through your office. And so those 80 to 100 students you're keeping them healthy so they can go back to class and participate in all the things that we offer here at Owasso Public Schools. So thank you so much. And thank you, Paul Croft, for being the director that's helping to oversee the nurses. I know they appreciate your support and everything that you do.
Yeah, they're a blast to be around.
Yes. And that concludes this podcast for Safety Talk Tuesday. Thanks for being with us, and we'll see you next time.